Joining me now is Dr. Adam Chinsky. He is a neonatologist with Women and Infants Hospital. Dr. Chinsky, we're so happy to have you here today.
Brandon, it's a real pleasure to be able to be with you and be able to provide some information for our patients in our community.
That's awesome. So tell me a little bit about how babies of COVID positive moms are being cared for post-delivery.
This was a big question very early on. How are we going to address a mom and her child at a time when we know that there's a potential risk, but we didn't also want to create any separation. So at Women and Infants, we really believe in mother-baby bonding and keeping pairs together. So a mom who comes in who is COVID positive or is suspected of being COVID positive and comes into the hospital because she's in labor, we're not separating her from her baby. We're keeping her baby and her together, but we're doing it with precautions. We're not just creating risk to the infant unnecessarily. We're keeping the moms and the babies in the rooms. The babies are being kept in isolates. Those are little environments with a shell around them to help the baby be protected. And we're allowing to stay together. If mom wants to breastfeed, we want to support her on that. We know that's her choice to be able to provide breast milk. So we want to encourage that and be positive with her. So during those times, we're just having moms wear a mask. We're cleaning off mom and allowing mom to breastfeed and hold her baby. And then when she's done, we're having mom be able to put the baby back in the isolate and allow her to stay in the room together. I know across the country that's very different. A lot of hospitals are creating a separation right after birth. The baby's born, the baby goes to a nursery, mom stays in her room. But that doesn't help answer the question about what do you do when you go home? You're going to tell that mom you can't be with your baby now? In the hospital, we separated you. Or the opposite, in the hospital, we've separated you, but now that you're going home, well, now it's okay. We looked at it and said, how do we empower the mom to be able to provide the best care to her baby in the safest way possible? So we're looking at that time in the postpartum period as really helping to encourage mom to practice safe behaviors, but also be in connection with her baby. So when she goes home, it's a safer environment for both. And the bond has been preserved.
That's excellent. That leads me to my next question. What issues, if any, have you been experiencing with treatment of babies once they leave Women and Infants Hospital?
In Rhode Island, everyone's doing their part to help out with COVID. Every little bit that people can pitch in, they're finding ways to pitch it in and do more. Our community pediatricians, they're doing the exact same. They're staying open and available to moms and babies, both babies that are not COVID exposed, but also babies that are COVID exposed. The wrinkle that rubs into it is, bringing in a family into your office that is a COVID positive family can be challenging for the staff, the office, and with the scarcity of PPE out there, a lot of the groups are worried about how they'll consume their PPE if the numbers start to go up. So we're partnering with our community providers to find, if they can continue to see COVID positive babies, they will. But if not, we found a way to expand the box of services that are offered through Care New England. And we've been able to partner with our pediatricians here at Care New England to be able to provide a specific COVID clinic just for babies and moms together.
Okay, so what services at CNE are being offered to new moms and babies to help combat COVID?
So it starts right after delivery. It's education from staff. It's education from the physicians. It's giving moms positive encouragement that they can do to help protect their family members, protect their babies, but also take care of themselves. At the same time, if a mom is worried about what's going to happen when she goes home with her baby, giving access to this pediatric COVID positive clinic allows mom direct access to a pediatrician until she's able to transition to her regular pediatrician or stay with that pediatrician. So access to healthcare providers, nursing staff. We also have the Warm Line, which is an informational line that's available 24/7 that any mom can call if they need help with breastfeeding or general baby needs. These are all standard services that are offered to all moms, but the enhancement is being able to provide that clinic for COVID positive moms that give them direct access to a pediatrician.
Dr. Adam Chinsky, neonatologist with Women and Infants Hospital. Thank you so much for all of your great work and for sharing this information with the public. We really appreciate it.
Rena, thank you so much. I've appreciated the time.